Hello there, welcome to the evening clinic. We're going to utilise the 4 filters of the Ophthalmoscope to perform some technical and in-depth ocular checks. I'm going to dictate the findings, so let me do a little bit of housekeeping here. Grading scale shall be the Vision Care Institute. First assessment is going to be with the blue light, cobalt blue filter, kilo ophthalmoscope. First checking corneal staining using sodium fluorescein dye. I can just show you the grading scale we're working from tonight. Corneal staining. Sodium fluorescein single use minimister. Okay, now this doesn't sting, so if you could please look up to the ceiling. Just place that on the bulbar conjunctiva. There is the cobalt blue filter. This is the larger aperture. Right, so if you look straight ahead, just scan the cornea. Okay, take a blink. Now I want you to take a blink and stare. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. To break up time, 10 seconds there. Right, take a single blink. Okay, now blink and stare for as long as possible. 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, and relax. I'm going to charge the ophthalmoscope between the segments. Corneal staining, right eye, single punctate looking spot, 3 o'clock. Tear breakup time with sodium fluorescein, invasive method, 9 seconds. Fellow eye, tear breakup time using the same method, 10 seconds. Very faint tracking stain, paracentrally, inferior zone. Patient no symptoms. Superficial to say the least. Okay. I'm going to use the large aperture white light filter here to my range of important ocular checks, so look off into the distance please. Okay, I'm going to face you dead on. I'm going to reverse a little bit. Just look into the light, please. Okay, look just at me now. Now you must follow the light just with the eyes only. Excellent. We're doing well there. Right, I'm going to come closer and observe some structures inside the eye. First, crystalline lens. Look into the distance, please. And then vitreous humour, looking for any vitreous opacities. And for the optic nerve, it's 0.3. Distinct crossings, healthy colour, neural retinal rib. Super. And now we're going to change to the middle-sized aperture. Look directly into my light. Look over into the distance again at 1 point. Okay, we have the target there. Look into the light. Look up to the ceiling. Check the peripheral retinas to the best of my ability. Look to your right. Look to your left. Okay, and look down, please. Okay, ophthalmoscopy on the left, a large aperture, crystalline lens, look into the distance. Okay, and vitreous humour. Optic nerve. Good, now palate. Venous pulsation, 0.4. Distinct margin there, lovely. Look into my light directly. one day I'll remember where these apertures actually are. Look directly into the light. Okay, and relax please. Pupillary reactions, direct and consensual, present right and left. No signs of a relative afferent pupillary defect. Hirschberg test, normal. Displacement of 1 to 2 millimeters right and left nasally. Shadow test, angle estimation, grade 3, right and left. Motility full and smooth. Ophthalmoscopy, right eye, crystalline lens clear, vitreous humour clear. Optic nerve head assessment, 0.3, pink and defined, macular clear, no eccentric fixation, peripheral retina clear. Left eye ophthalmoscopy, as right, except point for cupping, and Mittendorf dot observed. Crystalline lens, nasally, around 10 o'clock. Adding of bulbar redness, right and left, grade 1. Limbal redness, right and left, grade 1. We'll now proceed to check lower lid roughness and hyperemia levels. Okay, please just look up. I'm going to lower your lid. Look up again, please. And relax. Lid redness, OU, is grade 1 trace. Lid roughness, grade 1 again, OU. Look straight, please. White light assessment finalised with meibomian gland evaluation. No evidence of any meibomian gland dropout, right and left. Estimated grading, grade 0, including upper and lower lid margins. Okay, well, the ophthalmoscope charges for the next round. I'm going to instill some more dye into the eyes. Lissamine green. Again, this does not sting. again. Larger aperture, glycerin green. This is going to allow me to really evaluate those blood vessels, front surface and posterior surface. So look left, honing in on the conjunctival vessels. Okay, and right. Look up and look down. Now start off by looking to your right. And to your left. Okay, down to the floor. And up to the ceiling. Right, that concludes the anterior check with the green light. Let's have a look at the retina with the same light. Look straight ahead. Okay, look up again. And right. And left. And down. Okay, straight ahead again, please. Okay, look down now. Look up. And left. And to the right. Okay, that concludes the red-free evaluation. Sit back and relax. Conjunctival blood vessels appear normal, right and left, in terms of the retinal blood vessels. I'd estimate the AV ratio, right and left, at 3:4. No evidence of any tortuosity and no evidence of any AV nipping, again right and left. Right, that is all the ocular tests, but I did say there were 4 light sources. So I'm going to use the final yellow light source to perform some non-ocular medical tests. Let me show you what we've used. We have gone from white to red-free, cobalt blue, and now yellow. Of course, not in that order. Right, so I'd like you to open your mouth, please. Excellent. I'm just going to inspect the temples there. and just some of the skin of the forehead and nasally, and the neck there. Any skin issues? Excellent. Tilt the head back. Let's have a look at your nostrils. Wonderful, thank you. So that is everything. That's clear. No apparent lesions in the of the tissue there. Temples flat, no signs of any vascular engorgement. Nostril pathways clear. No apparent skin lesions, including moles, nevi or eczema. And also, when eyelids observed, no evidence of any lid hyperemia or general blepharitis. Right, so that concludes your medical examination. Thank you for coming in, and I'll see you next time.